The disorder topic that I chose is post-traumatic stress disorder. Micheala Clevenger. PTSD is caused by experiencing a traumatic event. A common misconception of PTSD is that it is strictly for those in the military, when in reality, post-traumatic stress disorder can be caused by an array of traumatic events such as car accidents or even certain jobs. Women have a higher chance of developing PTSD than men do, as well as those with pre-existing anxiety or depression disorders. There are many symptoms of PTSD. To be diagnosed with PTSD, you have to have 4 of the following symptoms for at least a month. You have to have at least one re-experiencing symptom, 1 avoidance symptom, 2 arousal and reactivity symptoms, and 2 cognition and mood symptoms. The re-experiencing symptoms would be things such as flashbacks of the traumatic event, having bad dreams about the traumatic event, frightening thoughts that are a problem in your everyday activity or routine. Some of the avoidance symptoms would be staying away from things that remind you of the event, avoiding thoughts and feelings that put you in the same headspace as the event. Some of the arousal and reactivity symptoms would be being easily startled, such as by loud noises, feeling on edge all the time, having difficulty sleeping because of the bad dreams previously mentioned, having angry outbursts for no apparent reason. You get angry at everybody over the slightest things. The cognition and mood symptoms would be things like trouble remembering key things from the traumatic event. Like if your traumatic event was a bombing in the war, you could forget where you were when it happened, what you were doing, what you were wearing, things that you would typically remember in that instant. You have negative thoughts about yourself or just the world in general. You have distorted feelings or a loss of interest in almost anything. There is no 100% effective treatment for PTSD as of right now. A lot of organizations and companies will try to prevent their workers from getting PTSD by mandating a debriefing after a traumatic event. An example of this would be first responders when they have to respond to a car accident where there's a child and the child dies. They will make it mandatory that the first responders go through a debriefing period before they can return to their normal work schedule, but this has been proven extremely ineffective. They are now saying that this can actually cause PTSD rather than help it. Forcing somebody to talk about a situation that they're not ready to talk about yet is the issue that it comes up, and they are seeing that there are actually many problems with this. If you think you have PTSD and you go to see a therapist or a psychiatrist, a lot of times the first thing they will try is medications for anxiety, sleep disorders, or depression, to try and combat that, to see if those will help. A lot of the times it doesn't, and the next step would be to try aversion therapy when you feel like you are ready to talk about it. The reason you have to be ready to talk about it before you go to aversion therapy is aversion therapy is where you go and you sit with a counselor, a therapist, or psychiatrist, and you talk about the event over and over and over again until you no longer have that same emotional reaction to the event. You have to train yourself basically to not get so upset about the event anymore. after the next step after talking about it is to watch videos that bring it up, and then so on and so on until you no longer have an emotional reaction whatsoever. Some PTSD case studies. I saw this on a PBS video. There was Warren King, and the other one is Bob, whose last name was not disclosed in the video. Warren was a Vietnam vet. He was a Marine. While he was over in Vietnam, he was a part of a bombing. When he returned home, the event that caused the PTSD, which was the bombing, obviously, he had nightmares for weeks afterward, and then he was put on medication for the previously mentioned anxiety, sleep disorder, and depression, and then he would try to self-medicate after the medications didn't help. For 30 years, he relived the war every day over and over in his head, and it caused such an issue that he became a hermit and blocked everybody from his life. He just stuck to himself so that he would quit getting so angry and reliving such a nightmare with other people around. He, when he would self-medicate, he would do uppers mostly to try and prevent himself from sleeping so that he wouldn't have the nightmares anymore. After 30 years, he heard about aversion therapy, and he tried it. After 16 sessions, he has a very slight emotional reaction to the event anymore, and he is an advocate for aversion therapy and says that anybody that suffers from PTSD should try this therapy. The other case study, Bob, was in the Iraqi War. He was a Navy SEAL. He was a part of a invasion troop in one of the bloodiest battles in the war. He saw an Iraqi soldier. He was next to a van that had just went off with a bomb, and he had a hole in his chest. Bob leaned down next to the soldier, and as he looked into the soldier's eyes, the soldier looked back at him and took his last breath while looking Bob in the eyes, and this has caused Bob to have PTSD. Bob's PTSD causes him issues in his day-to-day life as well. Him and his wife have moved from their home and moved in with their in-laws, with his in-laws, and it's preventing him from doing things such as getting a job. But the difference between Bob and Warren is that Bob refuses to try the aversion therapy because he is not ready to talk about the event, and he won't talk about it with anybody. He just tries to live his day-to-day life even though the PTSD is causing so many issues. Thank you.